Beautiful outside. Well, yesterday in our first of a three-part series on the mental health system in Cayman, we found out what mental health illnesses plague people in Cayman the most. We also heard from one mental health professional who says the problem is growing. Today in part 2 of the series, we meet a woman whose family knows firsthand what it's like to deal with someone who's mentally ill. This West Bay man was 19 years old when his family says his behavior suddenly changed from normal to strange. And at the time, no one, including his sisters, could imagine they would one day face the challenges of having a brother with a mental disorder.
It was in the 80s when he was properly diagnosed with schizophrenia.
Schizophrenia is a psychotic disorder characterized by withdrawal from reality, hallucinations, or emotional instability. Ella's brother has been institutionalized twice, but here at home is where he has spent most of his time, and this is where the results of his emotional breakdowns are clearly painful.
My brother becomes very violent, and I feel that he will attack anyone when he's in those violent conditions. I have been, I would say, injured. I had been in the hospital. But also, there has been a lot of the house structure and the furniture, whatever it is, that can be destroyed. A lot of windows and doors broken, and this is not just once.
But having a brother with schizophrenia is just part of this family's worries. Ella says the current mental health system in Cayman is not set up to treat patients like her brother, and this is of grave concern to them because they feel it's better to have him here in Cayman near his family.
I don't think just giving medication is the answer. I don't think just putting someone away behind bars is the answer.
And the lack of a long-term care facility, inadequate protection legislation, and officers of the law who are not trained to deal with the mentally ill are other areas Ella says need changes. And then there's a problem of stigmatism.
We can start loving each other. And in doing that, I think that we can build a firm foundation, knowing that nobody is immune to mental illness, but those that suffer carries a stigma that it's probably unbearable to anyone.
And tomorrow in part 3 of our series on Cayman's mental health system, find out what needs to be done to fix the problem.